We did it. We're here. One day it won't be so awkward to do this stuff. I blame Zoom. All right.
You
That
can.
said, hello. Good evening, everyone. I would love to introduce you to my dear friend Shannon. She's a retired OBGYN who has turned into a gender educator, which has been really awesome to see her shine and do her thing. She began her current career, especially being passionate about being a especially about being passionate about being a gender educator. After participating in a transgender advocacy development program where she was the sole cisgender fellow, so they let her in and learn all of our secrets. But for over a decade, she's been educating healthcare providers, such as herself, educators, parents, and communities about gender, which is partially why she's here this evening. And she also offers courses, and that's been a really great resource for businesses, healthcare providers, folks who are parenting, all that fun stuff said. I hope you brag more about yourself too. But yeah, without further ado, please welcome Shannon. Shannon, please take it away.
Thank you. What a nice intro. Thank you, Charlie. So, before we get started, I just want you to think for a second of the last time you went to a doctor's office and just imagine that time you go from the waiting room into the examining room. Maybe they weigh you, maybe they take the blood pressure. But as the person walks out and is getting ready to shut the door, they say the doctor will be in soon, or whoever the provider is will be in soon, and the door closes. How do you feel? If you have a chance to put it in the chat, do that for me. Give me just a one word. How are you feeling in that moment where the door closes and you're waiting for the provider to come in? Stressed is one answer. A lot of anxiety, anxious. Yes. There are a huge array of emotions that people feel. Some people can even be excited because maybe they've waited a really long time for this visit, but anxious and things like that. So that what we're going to talk about today it'd be a much longer talk if I talked about the entire visit, but I really is it going to be a long wait? Good question. I really want to focus in on the exam room. If we have to focus in on one thing, that's what we're going to focus in on tonight. And so, what I want you to leave is feeling a little bit more empowered in that examining room. And this talk, although it's posed towards the patient, specifically LGBTQ plus patients, and specifically because of my lens tends to be more transgender, non-binary patients, this talk is really good for everybody because I help a lot of people advocate the medical system regardless of their gender identity. So this really helps everybody. However, my lens is going to be there. So just to give you an idea of what we're going to do, I'm going to talk a little bit about, sorry, I have to move this chat box. I can't see the challenges that providers face when taking care of transgender non-binary patients. I'm going to discuss the challenges for the patients, and then we'll get into the 5 tips that I think can be really helpful for managing the visit. But before I begin, Charlie did a really good job, but I always like to give a little bit of the lens. So I always like to know what lens is the speaker looking through. And for me, as Charlie mentioned, I've been a gender educator for over a decade, did a fellowship, et cetera. I'm a retired OBGYN. So I've helped so many families, and I also have the medical perspective. I have this very unique view of looking at both. A little bit of understanding a bit of both perspectives. I am not transgender, non-binary, so I do not have that perspective in the examining room, but I have been so privileged to hear many stories. So that's the lens that I am coming from. So I said we'd start with the provider. And again, if you could put in the chat box, what do you want out of that relationship with your provider? I'm sure it's not like to be anxious. So what kind of relationship do you want? You can put that in the chat. And I don't think there's one. Everyone wants something different is my experience. To give you an example, some people want a provider that's going to just tell me what to do, be the authoritarian and just tell me what I need to do. Some people want a provider who is going to collaborate with them. It's like, okay, you bring your expertise, I bring my expertise on me, and let's figure this out together. Let's collaborate the healthcare together. See, I want to be trusted, especially to know myself. Excellent. There's another one, spend time with me. Yep. Caring and respectful. Listen, explain, diagnose. Yep. Answer my questions. Great. So, but here's the truth, especially when it comes to transgender non-binary patients, is that most physicians are not educated on gender. I think the statistics from medical schools is about 50% of medical schools are teaching about gender. And out of those that do teach about gender, not many coming out feel competent to take care of patients that are gender diverse. So this is one of I think, the big challenges and the consequence of this lack of education, or I would even argue, even if the education is happening, competent education, is that it affects the relationship. So we have decreased trust, which is interesting. That's what somebody wrote, like, I want to have trust, but we have decreased trust when we don't have the education, because sometimes what happens is the providers are afraid to say the wrong thing. And so they show up to the visit very kind of awkward and guarded and not very confident. So as a patient, you're like, what is going on here? They can also lack trust by not knowing the basis, like the basic medical information. I'll give you an example of what I mean. There was a patient, a family I was helping, and the child was going to the healthcare provider, not for anything to do with gender affirming care. The patient had been on puberty blockers since Tanner stage 2, so just the very beginning of puberty, never had chest development, never had a period. I do have permission to share this story, I just want to say. Never had any of that. And I think the provider was trying to be like, I'm totally comfortable with this, but I don't really know. And so asking questions, assessing a bleeding risk, said, have you ever had a heavy period? Now, if the provider had a baseline knowledge, they would know, or even quite honestly read the chart, they would know that the patient never had a period and that it'd be unlikely for anyone to have a period with the kind of medication protocol, when it was started, what was done, as well as no chest development, all those things. So because of that, it really created a distrust from the family that, okay, this provider doesn't know, but not only doesn't know, like didn't even ask. They didn't even ask, have you had a period? Pretended to have a knowledge they didn't have. So that's what I mean. Like sometimes that lack of education can really decrease trust. It can create harm for the patients by the speech, by the language that is used, by not understanding the difference between gender identity and biological sex. Gender identity, that inner sense of self of who we know ourselves to be, and biological sex is the anatomy, biological characteristics, etc. So I work on a committee that's looking at cancer disparities for transgender non-binary patients, and one thing that comes up a lot in our work is that a lot of transgender non-binary patients aren't being told about the preventative care, like cervical cancer screening, prostate cancer screening, etc. And so some of this may be because providers aren't sure how to bring it up, they're concerned, they're worried. So the other problem of this lack of education is that providers aren't providing the preventative care that is routine for many patients. And the final one I'll add with a story I have privilege permission to talk about is increased chance of misdiagnosis. Why misdiagnosis? Because a lot of us were raised, I would say most of us, were raised with certain understandings. Like we were raised under thinking that gender was the same thing as biological sex. Like, so it makes sense without the education, without challenging those beliefs, that those may be present. The other one in the medical system is that there was a belief for many years that gender diversity was a sign of mental health issues. We know it's not. However, I would say most physicians at the current time have been, I was going to say raised, not really raised, trained in a system that believed that. And so even if intellectually they know that that was all changed, not that it was, that in 2013 the medical system said, okay, this is not a mental health issue. It never was, but they finally recognized it in 2013. And However, if you don't challenge those beliefs and you intellectually know that's occurred, it shows up. So a story of on how that showed up, there was a patient that went in to a healthcare provider and their symptoms were very clear on what their diagnosis was, but the provider did do the testing that needed to be done, but dismissed it as a psychological disorder, even though the history was clear as day. So I talked to the patient. I said, I gave them some words to advocate. They did not want to go back to the provider. They went back to their primary care physician. I said, here's the language I would use because your symptoms are, like, I can't give medical advice, but these are the symptoms that were very clear on what was going on. Tell those symptoms. The primary care provider then provided them with the medical care that they needed, the medication they needed to improve, and their symptoms improved. But I believe that that initial specialist, the issue was they were so quick, and this is not an uncommon story, they were so quick to dismiss it as a psychological issue that they didn't really do what we're there to do. Listen, I think that was even what somebody said, listen carefully. It was all there in the history. All right. So remember this, that because sometimes after that last slide, it's like feels kind of gloom and doom, right? But you have the right decision. You get to decide if you're going to correct people that misspeak. You get to decide if you want to teach people. You get to decide whether you want to change providers. There may be other issues in there, but you get to decide. You can or can't. There's no right answer. You decide what it is for you. But that's the provider side. The patient side, let's take a look. One of the biggest challenges is anytime we've had past negative experiences in the medical system, it makes sense that we walk into that next examining room, especially if we don't know that provider at all, guarded. Many transgender non-binary patients, and quite honestly, many parents of kids, so that they're navigating that system, describe putting armor on to go to the doctor's office. I don't know if any of you relate to that, but they describe putting armor on to prepare, and it's because of those. So many times that will show up in the examining room as being defensive, guarded, and all of that, like I said, makes sense. But that's coming into that relationship that way. The other thing that might affect the relationship is the level of gender dysphoria at the time of the exam. That may affect how a patient shows up, what they're willing to do or not do, their ability to be present. And then the final one is a power differential. I don't care how amazing and wonderful the physician is, there is always going to be a bit of a power differential because they're the ones that get to make certain decisions on treatment, things like that. And so this is a little bit of the challenges of the dynamic. However, I think that especially that power differential, I don't believe will ever go away, but we can definitely lessen it and decrease it with some knowledge, with the knowledge to understand what your rights, your options, and your choices are, which is what I'm hoping to help you with today, if it will let me fill. Okay, so finally, the 5 strategies in the examining room. So the first one, and the most important one I think I could do, is state your expectations. Now, everyone's not going to feel the same way, so it depends on what it is you really need, but these are some suggestions I want to give to you. The first one is name and pronouns. And I want to say, so 10 years ago when I started doing this work, nobody was asking for pronouns or name beyond the legal name. And now we see a large number doing it. However, I find that many of them don't know how to use it. So if you say like, well, I already filled out what pronoun I want to use, what name, I strongly encourage you to set that expectation. The healthcare provider comes in, hi, I'm Shannon. I want you to call me Shannon, and my pronouns are she, her, that you can use to refer to me. Just state it at the beginning if that is something important to you. Another one is a list of questions. Many times, especially getting ready to see somebody, questions pop in your head. I always encourage people, write it down, and take that with you. I guess I'm still old school, so I still pen and paper it, but you can put a note in your phone too, I guess, if you like that better. But get your list of questions and have it out. So at the beginning of that visit, you can, or I guess bring your phone out. For me, it's paper, whatever, bring it out and just say, I have a list of questions I'm hoping we can talk about today. State that at the beginning, as well as expectation. I'm hoping maybe it's an expectation. I'm hoping to leave here with a plan of a next step on helping me with these symptoms. And then the final one, which I think is really important for everyone, is if you have special words you like to use for your body, then I would communicate that from the beginning. Healthcare providers are going to defer for medical terminology. They're going to use the medical anatomical terminology, and that's okay if you don't want that, but let it be known. So I often recommend whether you do any of those expectations verbally at the beginning, but also for some people, they're like, I'm not really comfortable speaking up in that way. Then you can bring a piece of paper. You can bring a laminated copy that they can take a picture and put it in the electronic chart that way. Or if you have copies, you can hand over a piece of paper that have those things, whatever they are, that are important to you. But especially the language around your body, I think it's really important to let it be known from the beginning, if that feels right to you, right? To say, not this word, but this word. These are the words, and you can see the example. Hopefully you can all see that. Question the questions. A lot of people were surprised. I didn't know I could do that. So in medical school, I was taught that every question I asked a patient had to have a purpose. And I always thought about that. Now, I don't know that everyone's taught that, but it is true regardless of whether they're taught that or not. So if anyone asks a question that you're like, wait, why are you asking me that question? You can ask them, why are you asking that question? I'll give you an example. I had a good friend of mine, again, I have permission to share this story, that went into urgent care with a sore throat. Now, he's transgender, and the doctor was asking about the sore throat, and somehow it came up that he was transgender, and right away the doctor said, what, have you had surgery down there? Okay, I'm guessing human curiosity took over there. And this is what I mean where that lack of education can do more harm. That question is very inappropriate. So it is totally go, hold on a second. Why are you asking me that question? And there's different ways. I like to give different examples of ways you can phrase it because we all have different personalities and different things may resonate or feel better for you. So you might say something like, it may help me to answer your question if I understand why it's being asked. So if someone asks you a question, you're like, why are you asking me that? You can just say, why are you asking me that question? Which is one of the options. Or how will that information help you? How will the answer to that help you? So these are all ways in which you can question the questions. I would guess that most of the time there is a purpose and we may not always realize it. And I do believe it'll help you answer the question more accurately if you understand why they're asking it. So you can also question before agreeing. Again, this is where I think that power differential comes into play. And depending how you were raised, I mean, I have to be honest, I was kind of raised that, oh, the doctor knows best. And so, listen to what they have to say. But I want to tell you that it's okay to question. Someone says, we should do this exam, we should do this procedure, you should take this medication, you should do this treatment. It is okay to ask their reasons. Understand what your options are. They are most likely giving you what they believe is the best option for what's going on. And that's okay to recognize that. And recognize that maybe there are other things, maybe like you are the expert on you. And so that's why I always hope that relationship is a collaboration, that you let them bring their expertise in biology and science, and you bring your expertise on you. You must consent, so go ahead and ask questions. And these are some of the questions I highly recommend when I help people to ask if they're feeling not so sure about an exam, a treatment, whatever it is. What is the goal? So what are we trying to find out? I'm an OBGYN, so I'm going to give the example of pap smears. What is the goal of that exam? Well, it's cervical cancer screening. What could happen if I do not have that exam or treatment? Well, the concern is that you could develop cervical cancer, and by the time a symptom would show up, then it would be further along, whereas we can find it a lot sooner through a pap smear. And then the third question, what other options are there to achieve the same goal? Guess what? There are other options now. There's self-testing, and I have heard some providers offer ultrasound, although you have to understand that it's not really good at catching, that it doesn't really achieve the same goal the same way. It will catch it possibly earlier than symptoms, but not really. But anyway, that's the deal. So questions to consider. What is the goal of the exam and treatment? What else could be done? And what are the other options? So these are all questions you can ask. The other thing, again, if you were raised like me, where the doctor's the expert, we forget sometimes, and I think it's important to remember that you have the option of no. No, thank you, but for the polite answer, but you have that option. So any exam or procedure requires consent. So you can say no. Or maybe you say, hold on a second, and you consider what we just talked about. Let me ask you some questions about this first. What are the other options? What's the goal? That stuff. And then, which is our next point, there's also the option of not yet. And what do I mean by that? Sometimes we feel like we have to answer right there in that appointment. And I will be honest, as providers, we're often taught to really, if you can do it in that visit, do it in that visit for a multitude of reasons. One, we don't want to charge the patient more money. We don't want to have the patient take more time to have to return. And we also don't want to lose the patient to follow-up, that some people will not return, especially in my previous line of work as an OB/GYN. No, thank you, not coming back, which is their option. But so there tends to be a pressure, let's do this now. But you have the option to reschedule. Maybe you weren't prepared, like, oh, I didn't know we were going to be doing that today. I'm not really ready for it. Maybe a patient has increased dysphoria and they're like, well, I knew I knew a pelvic exam was going to be done today, but I am not in the right space for that. That's okay. Or maybe you need time to process. Maybe they've recommended something and I want to gather some more information. I want to get questions from other places. Great. It's always an option. However, I want you to consider a few things first with rescheduling. What might it cost you? Will it cost you something else to come back and have another visit? Maybe yes, maybe no, but you get to decide based on how you're feeling today and that cost and how that might affect you. How long do you have to decide? Depending on what they're recommending, you can ask, how long do I have to decide? What would you recommend? What if I take longer than that? Again, going back to those questions to understand what those options, why they're making that recommendation. And then how long before the next appointment? Let's face it, it depends what specialty you're looking at. Some of them have very, very long waits, but it's good to ask the provider. Nowadays, it's so different. It used to be the provider could be like, I'll fit you in. And some providers still can do it, but some of them have no control over their scheduling. So it is an important thing to understand of, okay, if I want to make this decision and come back, how long is that going to be? So all things to consider, but it is an option. So just to review, state your expectations, whatever they are. You can verbally state them at the beginning. You can hand over a piece of paper, whatever feels right to you. When in doubt, question the questions. Why are you asking me that question? It might help me to answer that question. Tell me why. It's okay to ask questions before agreeing to anything. It's okay to say no or not yet. It's okay to consider rescheduling. All of these things I'm hoping will empower you to remember that you get to decide. And so there's one last truth I want to leave you with. There's one thing a provider will never be an expert at. And I don't care where they trained, I don't care who they are, they will never be an expert on you. You don't forget that. They may be an expert in biology, but you are an expert in you. You know how things affect you, you know how you're feeling, you know what your priorities are. So don't forget that. And I truly believe even those healthcare providers that make horrible errors due to their lack of education, the majority of us want to do the right thing. We want to provide great care for the patients. And so one thing that can help is your voice speaking your expertise on you. So before I open it up to questions, comments, I just want to let you know I talk a lot about gender, specifically for healthcare providers at Gender Matters Insights from a Physician. Anywhere you get podcasts, it's also on YouTube. You find it best under my name, and my website is there for any additional information. I'm happy to open it up for questions or comments. Feel free to use the chat if that feels better to you.